It's my pleasure to introduce the Dean of Medicine, Professor Ian Simons.
Good morning, ladies and gentlemen, and good morning to my future colleagues, some of whom are sitting perhaps in this room with us this morning. My name's Ian Simons. I'm the head of the School of Medicine here and the Dean of the Medical Program. And firstly, would like to acknowledge the Kaurna people on whose traditional lands we're meeting today and pay my respects to their elders past and present. Adelaide has a long tradition of medical education. We are the third oldest medical program in Australia, and over the course of 3 centuries have graduated more than 6,000 doctors who are working all over the world now and making a difference to the lives and healthcare of patients and communities. We are a research-intensive university. 2 of our alumni are Nobel Prize winners, and that has included achievements such as the development of penicillin and work in many other areas. All 14 of our research areas in medicine are ranked at well above world-class standard, making us the second highest ranking university on that basis in terms of healthcare research. But we're here today to talk about the education and training side of that, and in particular our medical program. And I'd just like to share with you some results of last year's graduate exit survey. This is an annual survey that's conducted 4 months after graduates leave university, surveying them for their view about their experiences. And it's classified in broad areas of education like health and arts and science and so forth. And I'm pleased to say that last year, Adelaide Faculty of Health Sciences was ranked top amongst the research-intensive group of 8 universities nationally in terms of its student evaluation of good teaching. It ranked second overall for student experience of all 38 universities in Australia in health sciences, and third overall in the development of generic skills and securing full-time employment after being a graduate of our Faculty of Health Sciences. So these are outstanding results, and I'd like to acknowledge the work of my colleagues and the staff who are involved in teaching the program, many of whom do so for free as part of their duties as doctors and educators, as well as our own academic staff in the medical school. This is a really exciting time to join the Adelaide Medical Program. We are about to move into the new Adelaide Health and Medical Sciences building, which is the biggest investment that the University of Adelaide has made in all of its history. $240 million building that you can see going up along North Terrace will be the centre of our medical, nursing and dental programs, as well as allowing us to have an integration between research activity and undergraduate education. This will usher in a new era in our medical and nursing programs, with students from both discipline groups learning alongside and with each other from the outset of their programs. And I think what I'd like to do is to get the students just to speak for themselves and tell you a little bit about that.
It's a key change in how we as the future health professionals will develop and collaborate. Nursing and medicine, very similar but completely different at the same time, and we're very much not in the same location, and it does make things hard. I think with the new building, it will just make it 10 times easier and I think more effective for the future, because they are our future colleagues. We will be working with them to provide the best care.
The new school will have great facilities, new state-of-the-art equipment, and it'll be a great conducive environment for me to learn, which will help me refine my skills to provide my patients with the best care possible.
I was here when the Robin Warren Clinical Skills building, the facility was being built, and I saw how much of a difference that actually made to how we actually learned, because they were hospital wards in the university, which was just an incredible thing to behold.
The students of the future will now be able to go from our building through SAMRI to the new Royal Adelaide Hospital, weaving together education, research and clinical practice. This is about transforming the healthcare workforce of the future, but it's also transforming the experience of the students that come through that. In addition, it's going to house 5 big research themes that will cut across one another and work together across those different themes to represent the bulk of our research strengths within our faculty.
The Adelaide Health and Medical Sciences building will be great because it gives nursing students the opportunity to learn skills and knowledge from high quality staff in the best facilities, as well as working alongside our future colleagues to provide the best care possible for our future patients, which is why I've become a nurse.
I'm really excited about the Adelaide Health and Medical Sciences building because from the start we've been instilled with patient-centred care, and this is a very important aspect of dentistry, and it'll also be a great learning environment that is very conducive for us to refine our skills and for us to be the best dentists that we could possibly be.
The way we learn medicine nowadays, it's a much more modern process with a lot of collaboration, not only between older students, between clinicians from different areas, but also other health disciplines like nursing, dentistry and allied health, as well as the research component of it. I guess one of the great things about the course here at Adelaide is we're having this new building which is in such close proximity to the new Royal Adelaide in this biomedical health precinct. We're able to be shadowing junior doctors in the morning, and then in the afternoon we're here teaching students. So it's one of the things I'm looking forward to.
So I think you can see, for those of you who've driven along North Terrace recently, just how much it's changed even since this video grab was made. And at the moment we're on schedule to move in and start teaching in that building in January of next year. So anybody who gets entry to the medical program this year will start their medical education career in what will undoubtedly be the best state-of-the-art teaching facilities of any medical program in Australia, alongside what will eventually be the best and most sophisticated teaching hospital in Australia as well. So I would now like to hand over to Associate Professor Ray Peterson, who's our Head of Medical Education, who's going to tell you a little bit more about the medical program before we have our panel discussion.
It's just on midday by this clock here, so I guess I'll say good afternoon and welcome. Thank you for coming here on this Sunday. And yes, my job is primarily around the medical clinical education program. And what I'd like to do is give you just a little bit of a snapshot in the time that we have. Obviously, it won't cover everything, but some of the things that you possibly should be thinking about in terms of where this program takes you and what can happen after you graduate. So we've already heard about it being the third oldest program, but the curriculum is not old. It's actually a very modern curriculum. It goes through constant review and change as we include more contemporary and innovative things that are important as part of the training of new doctors. And so that's that's a very big feature of what we do in our program. I guess the key message is that you will start with learning how to be a doctor from day one. We don't expect you to be a doctor in day one, but everything is designed so that you're building the skill sets, knowledge and skill sets that you will need to progress through the program, and also when you graduate at the other end, you're ready to be an intern. We don't want any of our graduates to have surprises and think, oh, I wasn't ready for that when it started. So much of what we do is giving you the foundation knowledge and also the clinical skills, the clinical education, and a range of other experiences that will start and continue throughout the program. So there is quite a lot of structure within the program, although some people would think when they first start that that's something quite new to what they had anticipated. So what can we expect in this program? I guess the key thing is that it will be a little bit different, maybe, I'm not sure, but it could be different to what your experience at secondary school is. It's about not just acquiring information, it's about learning how to learn. Because if you enter this profession, your learning never stops. Okay, you will be learning throughout your whole career as things change and as things develop. So part of our role is not only to give you the information that you need now or in 6 years' time, but also what you'll need to be equipped with to make change as change presents itself over the rest of your career in this particular profession. We're not about training you to just get a high distinction or a credit or pass or whatever it might be. It's about equipping you with what you need to do to be a good doctor. Okay, that's an important thing. We want you to be a good doctor when you graduate, and so all our training is about those particular elements. You will work in teams quite a lot, and you will learn together. That's a very important part of what we do. So I describe it as you're not in a race, you're here to enter a profession, and what we would do along the way is give you the skills sets to meet the standards to be part of that profession. And one of the important parts of this program is you get to hear real patient stories, not obviously necessarily the real patient, but you get de-identified stories about patients which are quite important to use as part of your learning. So, one of the big things that has changed over medical education and clinical education over the last not just few years, but in the last 10 plus years, is clinical simulation. So one of the things that you might be worried about or what you're thinking about is, how do I go from having all of this information to actually then being able to work with a real patient in real time? The short answer is we don't expect you to do that. We would never expect anyone to do that in this modern age. So we have what we call simulations. We have a simulation centre. We have, as was mentioned on that video clip, we have the Robin Warren Skills Centre at the moment. And so what happens is that students from very early in their career are interacting in situations that are like the real clinical situation. So we have people that are what we call actors or simulated patients. They role play various situations for us. And you as a student get the opportunity to take a history with maybe that person or even start doing some physical examination. So you learn how to develop the skill sets through our simulation program. And that continues all the way through. So in the early years, it's very straightforward and it's about history taking and physical examination. By the final year of your program, you will actually be doing simulations which may relate to what I will need to do as a doctor in my next year when I graduate. what happens when I'm on call or in the early evening shift and a patient comes in and I need to work out what is going on. So we prepare people for that through this environment which we call clinical simulation. And it's a very important part of what we do. The other part that was relevant there was that a lot of the simulation work has students working in teams. Interprofessional learning, working in teams with nurses, other health professionals is all part of what we do as part of the training. And it really doesn't stop after you graduate, by the way. There are many professional groups that actually do simulation as an ongoing basis. So that's a very key part of your development as you go through the program. So what can you expect? Well, I'm not going to tell you, I can't tell you in this short period of time everything you can expect, but I think the key part that I would like to tell you is we do think much more about the transition into year one. And in fact, there's quite a lot of work that has been done now to enable students to move into year one, which we probably didn't think about 15 or 20 years ago. We spend some time introducing you to the way we would like you to think about your learning. We introduce you to the way in which you need to be small group focused and how you work in small groups. We also have the situation where people need to adjust to not just having a subject that you do, for example, like biology or chemistry or whatever it would be, but in our case they would be anatomy and pathology. We tend to integrate all of that information through the teaching style we have. So that's quite a skill that people need to develop, how to use the relevant information from physiology, anatomy, whatever it might be, to actually work out what's happening in one of these clinical scenarios that you will be involved with. So that's essentially what to expect in year one, and I'll talk a little bit more about the program and how that evolves over the next period of time. So what's involved? Well, it is more than this, okay? Yes, you do need an information base, but it is actually a lot more. If it was just about information, you could probably go on the internet and find it all right now. But it's more about being able to apply it. So that's one of the key differences, one of the things to think about. It's about how we bring all this together and apply it to a relevant case scenario or a health scenario, whatever it might be. So, and we've talked about community and global healthcare there because they are equally as important as the individual that we most often see. So it's about those sorts of things that we need to think about. It is also a little bit of an art. Well, in fact, it is an art. There's a lot to learn about communication. There's a lot to learn about how you work in different situations with different people, different cultural contexts. You know, there's the whole empathic sort of relationship that you would need to develop with people and their communities, families and so on. How would you work in these different situations? And this is where the simulation process works. We actually have a stream called Medical, Personal and Professional Development, which spends not an inordinate amount of time, but a significant amount of time to actually develop those skill sets that we need. And finally, as I mentioned earlier, there is a knowledge base that we need, but we also need you to be able to continue using your knowledge base and building on it. In some cases, it may need to adapt with the evidence from research and so on about how things actually work, because things certainly don't all stay the same. So what is the time commitment? It's full-time study, and we would say that the program does involve about 45 hours per week of your time. And I'll give you an example of how the week is broken down shortly. However, That's not 45 hours of contact time. And you'll see that when you start the program, you'll have about 25 hours of contact time. By contact time, that means teaching sessions in tutorials, lectures, whatever it may be. All right, but the program is designed so that you have this extra time, this extra free time in quotation marks, to actually do some individual or further group study. You would find it very challenging to just squeeze everything into the 25 hours contact time and make things work for you. What I describe it is that you get a lot of information and you do a lot of individual learning, and then you actually need time to think about it and start putting it all together. So the time commitment is reasonably, well, not high, but manageable, but you just need to think that it's not like some people may talk about, that I do a degree and it's got 14 hours contact time and it's easy. So, but there is structure around how you would use that other time in each week of the program. So let's just talk a little bit about the classes in year 1 to 3 so that you get a little bit more of an idea of what actually happens. I'm a bit too keen on the buttons at the moment. So most of your work would not be in a lecture theatre like this. You will be placed in a group with 8 to 10 other students for a number of activities. And one of the activities is the case-based learning. So all of our learning predominantly happens where you are with a group of students, let's say 8, with a tutor, and you're given a clinical case scenario. And in that clinical case scenario, you actually start working through that over about 6 to 8 hours to try and work out what's actually going on. And to help you with that process, yes, there will be some lectures during the week with important information that links to the clinical case scenario, and then we actually start doing some other things around that. So if the case was about a child, you might then have some clinical case or clinical simulation activities or communication skills activities where you actually learn how to communicate with the child and their family. Okay, because there's a range of skill sets that you would need. We wouldn't expect you in year 1 to have all of that, but we introduce those ideas. So, and then of course, as you're solving that clinical case scenario, there will be some anatomy, how the body functions and the physiology that you would start learning as part of that. So you're starting to build a picture of how the body works, but it's all applied in context to a clinical case scenario. And that continues right throughout years 1 to 3 for what you will be doing. So you will see, obviously, I think it's about 65 cases over that time, but in that 65 cases you will have mapped an enormous amount of the curriculum and the sorts of things that you would do, so that when you then move into year 4 and 5, you are ready to actually start working with real patients in real time. So the first 3 years is about developing that sort of skill set, in fact in year 3 you will spend 1 day a week in a hospital as part of your preparation to start taking clinical placements in year 4 and 5. So if you step right back, clinical skills starts at 2 hours a week in year 1, 2 hours a week in year 2, 8 hours a week in year 3, and then full-time in year 4, 5 and 6. So year 4 and 5 is where you will be much more clinically focused. You will be potentially in a hospital or a community site, and during that time you will go through a range of clinical rotations or attachments, as we call them. So yes, you will do medicine, yes, you will do surgery, you will do paediatrics, you will do psychiatry and so on. So they're what we would call our clinical rotations. And then there are some other opportunities in year 4 and 5 for you to do some electives. Now, these elective opportunities enable you, apart from the core things that we want you to do, to actually start having experiences in areas that are of interest to you. And the reason you might want to look at an area of interest is that I'm thinking I might want to do that in the future. And so I'll do a 3-week attachment in that area just to see what it's like. And that's part of what we do. We have a range of these attachments, and they can be in more specialised areas like respiratory medicine, things like cardiology, which you are probably familiar with. But we even have another attachment which is in aviation medicine. There are people that have an interest in working in that particular area, and we've been able to create an attachment for them to do 3 weeks in that field. So we have a broad range of attachments, and people elect to choose, and they create, in a sense, their own program from a structure that we have. So that's predominantly the clinical placement mode. Some of you will also, and you're probably wondering about this slide, there are rural opportunities as well. There are a number of rural opportunities within the program, and in Year 5, the students can elect to do 1 year in the country. So we have a whole program that is run through our rural attachments in Port Lincoln, Whyalla, Port Augusta, Clare, and so on. And the students, approximately 42 I think it is this year, spend the whole year doing exactly the same program as the one that would be located here in the city. And so they get enormous experience working in rural locations with rural doctors, rural communities, and just seeing what those differences or what similarities there are. And some people are actually making decisions about what they would like to do, post graduation, and whether the rural stream is something that they would like to take further interest in as time goes on. The other part of it is that during Year 4 and 5, if you have an interest in research, as Professor Simons mentioned earlier, people can do electives in research. Some people would like to eventually be what I would describe as a clinician scientist. They want to combine their clinical work with some scientific research. Others want to do public health research with their clinical work. And so there are opportunities for people to take a research direction as far as that. This is the best year, I think, for you, because at the end of Year 5, you can get rid of the thought of any written examinations. They're all gone. Okay, so Year 6 gives you the opportunity to just be a trainee junior doctor. You're not actually a doctor, you're a medical student, but you can immerse yourself in the sorts of things that you will need to be able to do the following year when you do graduate. So it's everything that is assessed on that year is what we call in-training assessment. It's clinical assessment that is done by the clinicians in the placements that you have. So the year is divided into 2 parts. One semester is what we call an internship semester. So every student gets to do medicine, surgery and emergency medicine. They're 3 key areas that you will be doing the following year as a doctor. So you get a chance to see how it will be to be an intern and maybe shadow interns, shadow the medical team and actually get a better understanding of what happens there. The other semester is essentially elective, or we actually call them selectives, but they're electives, but there's a structure around it. And every student does 4-week blocks one in general practice, one in psychiatry, another one in medicine and one in surgery. But they can be in a whole suite of areas. And in fact, people are encouraged to even look at interstate and overseas placements as part of that program. So we have a large number of our students that would actually spend some of their time in a community setting overseas. We have one doctor that has regularly been having students in his small community hospital in Papua New Guinea for the last 10 years, and students go there for a sometimes 4 or 8 week placement if we can arrange it. So Year 6 is all about building your clinical expertise ready so that when you graduate you can be an intern. So where can this degree take me? Well, there's many options. We've talked about all of the clinical practice areas that might be important to you, and we will train you in all of those. Some people decide that with a PhD, with further study, that they will end up doing some scientific or clinical research. Other people are interested in, and this is becoming increasingly important, well, population health has certainly been around for many years, but there's even a move to much more in terms of global health. And people work in various organisations around that. You could, for example, decide to become an academic, clinical academic, and one of the beauties of the MBBS qualification is that people can combine both clinical work with teaching and education. So that's another option, and there's many people that do that because they are the teachers that work in our program. There's another field which, if you're interested in law, and I know someone who's done this, and they combine their medical training with what happens in law. Other people go into health services, business management in terms of, especially if you've got an MBA, and if any of you know that I'm sure some people end up in politics, or you can choose any of the above and combine them in whatever way you want. So it's a degree that gives you the opportunity, once you've completed the 6 years with us and finished your internship year, you then go into what we would call professional vocational training in an area of your interest, but it opens up many doors, and people choose those doors depending on what their choices are. I think I should move on. I've probably been talking too much. Am I okay? Oh, good. Okay. So I just need to move on to the entry requirements just a little bit, and so that you know what is required there. The UMAT is obviously something that's part of the process, and I described the medicine domestic entry overview. There's UMAT, SATAC application, interview, academic results, prerequisite subjects, application outcomes, and there's the merit ranking process has those percentage weightings as indicated on the bottom left-hand part of that slide. There are some subject requirements in terms of entry, in terms of SACE, biology or chemistry or mathematical studies, and similarly in IB biology, but most of this information you can gain elsewhere, and I'll talk about where that is in relation to the program. There are also some equivalent university courses that you can do that enable you to enter into the program. I just have one little comment to make, that if you are an international student and you're doing Year 12 here, a Year 12 Australian qualification, you would need to submit a formal application through our international office as well as through SATAC, but all that information is available in our admissions guide. Okay, so that's the process, and it's getting close for the UMAT, for those people that are thinking about it, that it actually closes on June the 3rd. So registration, if you were interested in thinking about this for next year, I guess, or that registration period closes then. We don't endorse any private UMAT training program. That is entirely up to you. Okay, but we do not endorse any of those. We leave it to individuals to work out what they would like to do in relation to that. And there are practice tests on the ACER, the Australian Council for Educational Research website, for people to actually do. But if you are looking at this process, you need to make sure you have those dates and everything sorted in relation to that. Can I just refer you to the 2017 admissions guide? It will be online as well as elsewhere, and that has all of the information that you would need to know, partly about the program, as I've talked about, but also what you need to do to get into the program. There are 2 MBBS SATAC guides for people that are applying through SATAC. And I think you need to just be aware of those 2 codes. These will be in the admissions guide. A non-bonded medical place simply refers to these places have no return of service obligation after graduation, which will make sense when I talk about the bonded one. In a bonded place, students are they're accepting that they will undertake work in areas of workforce shortage after completing their professional training for a period of time equal to 12 months. Okay, so professional training by definition can be after if you, for example, decide to be a general practitioner, you would do that professional training and then you would be required at some stage to complete that 12-month commitment. People can elect to apply for both of those or one of either of them, I guess, through that SATAC process. So I'm sure if there are any other questions, you can ask during the question time, but I guess my main message is that the training is all about building your capacity to be a doctor so that when you finish our program, you are ready for the next stage to be an intern. And we spend an enormous amount of time making sure we cover all of those aspects, and there are many more that I haven't talked about that are important so that you are equipped to do that as part of the program. So I'm going to now introduce our student panel. We have 2 students who are within the program and a recent graduate, and I would ask them to come forward and I'll get them. It's easier for them to probably introduce themselves and to say a little bit about where they are in the program or not, if they're the graduate, and what they're currently doing and what they're doing in relation to the medical program, if there are some other interesting bits. So please come forward. And
hello. Oh, good. Hi guys, I'm Ethan. I am currently a 4th-year medical student. I am quite interested in research and teaching and actually want to become ultimately a clinician scientist. I also really enjoy advocacy, and I've been on a number of university committees, including last year what you could think of as the board of the university. And I'm originally from LA, but I've lived here for about 12 years now.
Hello. Hi. My name is Najana, and I am a 2nd-year medical student now, and I come from a rural background. I'm also a transfer into medicine, and I'm currently stressing about exams that are coming up.
Hello, my name's Tharani. I graduated just over a year ago from the program. I'm currently doing my 1st year of basic physician training at the Royal Adelaide and Queen Elizabeth Hospital.
so the situation is now that this is an opportunity. You've heard what I've said, but you would, I'm sure, have questions that you may even want to ask the students or an individual member of that panel about some aspect of their training or what they're currently doing. So, yes?
Why did you choose to study medicine?
So I'll repeat the questions just so that other people can hear them. So it was, why did you choose to study medicine? Yep.
Is that to me? Okay. I guess I've always liked health sciences, and I've always wanted to help people, and medicine just always appealed to me, and it's something I always aspired to be, so that's my reason.
I guess for me, the thing that probably most attracted me to medicine was the flexibility in terms of where you could ultimately end up. Like, even once you, I always say this, but even once you get into medicine, you still haven't really decided anything about what your life is ultimately going to be like, because there are, 25 plus medical specialties, and each one of them, or in each one of them, the subject matter that you're dealing with on a day-to-day basis is different. The amount of patient interaction you have is different. The sort of extent to which you're diagnosing things as opposed to maybe sort of treating things is different. And, there are even other aspects. Like, you can choose to go into research or teach, and you can modulate the degree to which you do all of these things. And you really have a lot of, I think, choice choice regarding what you'll ultimately end up doing day to day, which I think is awesome.
The only thing I'd add to that is that medicine gives you the opportunity to do the science and become an expert in whatever scientific field you like, but also to interact with people. And I think if you're the sort of person that wants to talk to people on a day-to-day basis, but also wants to be really involved with science and the new things that are coming out in terms of medical research, it's a good opportunity to do both.
And just quickly, another cool thing about medicine is that I think, uniquely get to work with teams. You get to work as part of a team towards a sort of common goal, which is helping people, like, if you want, anyway.
Good. Other questions? Yes?
Sorry, just kind of ask a question from you. In terms of the entry to the medicine program with the bonded and non-bonded, is there any difference with the admission requirements in terms of the academic?
No, there's no difference. Basically,
we should repeat the question. Yeah.
So this guest asked about the entry requirements for the bonded versus the non-bonded medical places. It's exactly the same. Essentially, what you're doing is just telling us straight up which particular place that you're interested in. If you're interested in both, then apply for both. So it's exactly the same. It's just that you used to tell us at the end of the process, but now we're getting you to tell us up front. That has mainly implications for people perhaps from New Zealand who can't accept a bonded place, so they would then only apply for that non-bonded place. So essentially it's just allowing you to tell us what you're interested in straight up. Yeah.
There was a question over here somewhere, I thought. Yes?
I just wanted to ask the student panel what they're learning about at the moment or what cases they're working on.
So the question was to the student panel, what cases are they learning at the moment? Was that it? Or what they're learning about at the moment? So, yeah.
So I'm actually on holidays. But I've just, so because I'm in fourth year, the way it's sort of set out is you have sort of 2 18-week blocks, and you're basically just in the hospitals the whole time unless you're doing a research elective, or unless you're on a placement out in the community, like in a GP practice. So for the past 18 weeks, I did have a research elective first, so that was 6 weeks. That was at SAMRI, which is the big pineapple building on North Terrace. And then I had MSK, which is sort of orthopedics, so bones and muscles, fractures, and so on. And then I was just had psychiatry. And all of them have been a lot of fun, actually.
We just finished a big case on type 2 diabetes. We are currently working on kidney disease and different pathologies of the kidney. And there's a big focus on renal physiology, so that's what we're doing at the moment. We're close to finishing this case, though.
No, you're past that. Yes, right up the back. There's a microphone up there, I think. So.
Just 2 questions. First of all, how does rural entry differ from normal entry? And also, to the girl in the middle, have you had a chance to go back to a rural community and do stuff there?
Do you want to do your bit first?
Okay. In regards to the second part, I haven't had a chance to go back yet. I'm still pre-clin, so not just basically based in the med school. But in regards to how how the entry changes, I'll refer that to Ray.
Essentially, the arrangement, and it's the Commonwealth Government have some influence in this as well, that 25% of our clinical year students do 50% of their time in the country. So for us, that actually, the way we manage that is that predominantly that is our 5th year program. We have around 40 students that would be there this year, and in most years it's by choice. So we've very rarely had to ask students to go there. We could, but the strength of that program is that people actually really enjoy the opportunity that it provides. So we've been fortunate that we've had many students that elect to go there to meet that quota. Does that answer what you wanted to know?
Can I add something to that? So apart from the 5th year program, there's a lot of opportunities to do rural placements, so rural GP placements, and then the other big one is in 4th year you can do your surgical 9-week block in the country. So I did 9 weeks in Whyalla, and they're really popular rotations because essentially it's you and a surgeon, so you're assisting most for 9 weeks, and it's really good sort of practical experience. And so there's a lot of opportunities to do that side of things. So for example, if you go to a rural GP practice, you are consulting generally, and then you just get checked off by the GP. So it's very good experience.
There was another question I saw somewhere. Up there, back there on the right, you're right.
Just with the student panel, what did you find were the best subject choices for you in your secondary schooling that helped your progress into the degree?
So, I actually, personally, I think that my subject, I did the Suicide 5 and then I also did biology. I think that most of them weren't actually helpful. Actually, probably, I don't think it matters too much, to be honest, at all. Like, some people think chemistry, for example, is important. I don't think you really need to have done chemistry at all. And there's a little bit of physics that comes into 1st year, but it's sort of for about a week. Biology is probably the one that, if you do it, it'll give you a bit of an edge. But you can definitely get by without having done biology. You pick the things up that you need to know in 1st year. It'll just be a little bit of extra work.
I have to agree with that. Not much was very helpful. But if anything, biology would be the best one to do because, yes, it does give you a bit of an edge when you do start, especially because there's a bit of a focus of biology in 1st year. But, yeah, stick to the sciences maybe, I'd say.
I guess my advice would be choose the subjects that you're going to do best in, to be honest. Like, you need to sort of get the best HR that you can get to sort of be the most competitive, and so you should choose what you are passionate about and therefore can do the best in.
And I'll just make one very brief comment that 1st year as part of that transition, when I said that we do a lot that's integrated, there is one course called Foundations of Biomedical Science that's run by the Faculty of Science that all 1st year students do as well. So there is, and that is only for medical students, and it's designed to align with what we're doing in the rest of the medical program. So there are bits that we do to help support that as well. Yes?
Group work's quite difficult, agreed?
Agreed.
What happens if you don't like a group or your group's not working as a group effectively? Is there things in place to actually...
Too bad.
You asking them or me?
I'm asking both, or everyone.
Yeah, that's fine. Yeah. Do you want to go first or no?
Yeah. So the question was sort of how do you manage difficult group situations? Yeah, I mean, you sort of just have to figure it out. Like, one thing though to keep in mind is the people that you're working with in medicine, they've gotten through this sort of quite rigorous, as you guys probably know, process to sort of get in, and so they're all sort of like-minded people, or a lot of them anyway, and they're people that are generally easy to work with. Yeah, so there's that. So like I don't think I've actually had that many experiences like that. I guess one thing is that it's the kind of group work that we do isn't so much the group work that a lot of other university students do. I think like it's not okay. Here's an assignment. You go off with a group and do it. It's you show up to these tutorials, these 2-hour tutorials that are sort of moderated by a tutor, and you just discuss what you have gone home and studied sort of yourself, or the things that you've picked up from the lecture. So you don't really there are a couple exceptions. Maybe in the whole preclinical years you do have a couple group assignments, but in general it's basically coming to these tutorials with the knowledge that you've revised beforehand, and sort of just discussing it with the group under the direction of the tutor.
And I think the other thing to keep in mind is that every day working as a doctor is in teams, and so there's always going to be people that perhaps you don't click with or you're struggling to work with, but it's about working through and how do you work through those issues, and getting the practice as a student is so valuable because every day we have to be working, we're never working in isolation, so it's a good way to practice that in a safe environment as a student.
And did you?
Oh no, that's okay.
You sure? Well, you can. I guess the premise is the curriculum, the educators in this program, is that we are asking people to work in professional teams, and we spend in that first semester and right through, in particular the first 3 years, the students are getting feedback from their tutors about how they're working on progressing on the case scenario as a group and even as individuals, and we do that in a constructive way so that people learn how to learn and use the skill sets that they're developing within a group and by themselves. So it's actually a work in progress. We don't necessarily expect everyone to have the group learning experience that we think would be important, and we train people in the process of doing our clinical case scenarios, so it's all about learning how to reason. So there's quite a lot of work that happens. So as Ethan said, most people there, I think, would see themselves as needing to do this because there's a job to be done and the work needs to be done as a group. We haven't done this in the last couple of years, but in recent years we did have a little activity where we got students to do something on their own and then to do something in the group. And the short answer is that they have better outcomes if they do it in the group because they can't do it all on their own. And that's the key to what we do. One more question?
Just a couple of quick things. How many places are there in the program? And obviously it's a rigorous process to actually get accepted and join the program. Are there specific qualities that perhaps the panel have noticed in their fellow students or colleagues, or that perhaps the interviewers, etc., are looking for? Is it a particular type of person that succeeds in this program?
Did you want to answer the numbers a bit?
Sure. So for domestic students, we have approximately 112 places per year. That does vary very slightly from year to year. And then we also have 30 international places as well for international students. In terms of the types of students that we see, in the admissions guide you'll note that there is some criteria for the students, but to sort of not practice with, but to be aware of the types of things that they're going to be assessed on. One would be their motivation to do medicine, so what's actually driving them to study medicine. Obviously they've considered other things along the way, and what is it that keeps driving them back to medicine. The other thing would be definitely looking at their communication skills and their problem solving and critical thinking skills. As Ray's mentioned, our degree is taught very hands-on and you're expected to be quite professional from the beginning, and so we need the students to have an element of those points as they come in. Yes, they'll develop over time, but I think essentially being a good communicator is probably the most important thing to begin with.
I think that I'm not allowed. I've got the sign, no more questions, I think.
Okay, so we will have time for you to ask some more questions to the panel and to the academic staff out in the foyer in about 5 minutes' time, but I just have a few more slides to run through before we finish off. So, as Ray mentioned earlier, it is quite different to school, to what you're learning in high school and how you're expected to manage yourself when you first come into university. You won't have somebody telling you that your assignment's due on Tuesday, and that your assignment's due on Tuesday, and that your assignment's due on Tuesday. You'll be expected to know exactly what your timetable is about and exactly when your assessments are due. And the university is very aware that because it is quite different to high school, sometimes students find that transition a little bit difficult. So we have developed what we call our peer mentoring program, and 2 of our panel members are part of that program. So essentially it's helping you in that transition to university, helping you to understand what the expectations are of life as a university student, but to also gain that sense of belonging here at university. It's a very tight-knit group and we want you to be part of that. So essentially the peer mentoring program allows you to self-select a mentor, either online who'll communicate with you via email, or who'll meet with you face-to-face. And it's a really good way just to have your questions answered, to have a sort of buddy here at university who's already been in your shoes and can just kind of give you the lay of the land and help you with those things that you might not be aware of. So I would really encourage you when you, if and when you do get made your offers, to consider joining the program just to help you in that transition. The next opportunity for you to come and speak with us is on the 14th of August at our open day. It's a great time to, again, come and talk to the students and the academic staff, to also view the campus and have a look at things like the simulation clinics and whatnot. So I really encourage you to come along and see us all on open day on the 14th of August. And finally, for all you young ones, you need to like us on Facebook. It's a really good way of keeping up to date with what the faculty's got going on, to hear from some of our students and just see these types of events that we have planned, and also just, you know, what goes on here at university as well. Okay. All right, so ladies and gentlemen, thank you for attending today. If you do have some further questions for our presenters or our student panel and Tharani, our graduate, please feel free to make the most of the next 10 minutes with them. Just outside in the foyer, if you could exit to on that far door. But thank you for coming.